This is Dr. Robert Bates at Leominster Chiropractic Spine and Injury Center. Today we're going to discuss carbohydrate. I am going to go through a slideshow that I have used in the past to teach a wellness series of lectures, and hopefully you will understand exactly what happens to you when you eat carbohydrate, and especially simple carbohydrate, and this will change your knowledge base and help you to change your behavior. Because right now the consumption of carbohydrate, and especially sugar and simple carbohydrate, is responsible for a great number of the health problems in this country.
Carbohydrates are a necessary component of the human diet. There are both simple carbohydrates and complex carbohydrates. Simple carbohydrates are sugars, and they are composed of one or two sugars. They are refined and have very little nutritional value. When we eat these, they push glucose or other sugars into our bloodstream and therefore are noted to have a high glycemic index. When they do enter the bloodstream, it causes secondary reactions, including an increase in insulin. Complex carbohydrates are made up of 3 or more sugars, and they are usually much better for you with fiber, vitamins, and minerals. However, they also break down, if digestible, into simple carbohydrates. Complex carbohydrates are found in vegetables, wholemeal bread, and cereals. When you eat carbohydrate, your sugar elevates in your bloodstream and insulin is reduced or released into the blood. Sugar, which is stored as fat and triglyceride form, is made up of 3 fatty acids and glycerol. It is stored as saturated fat and about 98% palmitic acid. It is very bad and harmful to eat excess carbohydrate because it is stored as saturated fat. For one to think that they will not gain body fat if they eat carbohydrate and avoid fat, they are much mistaken. Your body stores about 1 day's worth of energy as glycogen from sugar, and the rest of it is stored as fat. Carbohydrate intake increases your insulin. Increased insulin reduces insulin sensitivity, and we develop insulin resistance. The increased insulin downregulates the receptors to reduce the toxic effects of insulin. It is your body's intelligent mechanism to stop the effects of insulin by reducing the insulin sensitivity and receptor sensitivity on all of the cells. However, insulin resistance decreases your lifespan and increases lifestyle diseases. When you consume carbohydrate, it regulates which fuels are used for energy. It controls storage of fat and protein, and it also stimulates the sympathetic nervous system, which releases cortisol and catecholamines, or the stress hormones. Carbohydrate intake also causes a problem with vitamin C, in that the vitamin C and glucose use the same cell receptors, and when you have excess glucose in the bloodstream, it competes with the vitamin C and you absorb less of the vitamin C. Also, you can have an increase in resistance to vitamin C intake if you develop insulin resistance on the receptors of the cells. Furthermore, glucose that is 120 as a level which is only slightly elevated, causes a considerable reduction in part of the immune system functioning. Carbohydrate intake also, with increased insulin, activating the sympathetic nervous system, causes cortisol to downregulate cellular immune response. Increased cortisol and catecholamines cause a person to be more nervous, cause carbohydrate craving, and reduced serotonin, leading to depression. And this does sound familiar with a lot of the people we see. Insulin resistance happens in a sequence. You first start to develop resistance in the liver, and then in the muscles, and thirdly in the fat cells. Insulin effects. Insulin stores many of our nutrients, and therefore when you have insulin resistance, you have a reduced absorption of magnesium, you have reduction in the relaxation of muscle, including smooth muscle, which does lead to constriction of many vessels and increased blood pressure. The reduction of magnesium absorption causes blood pressure to further increase because magnesium is needed as a cofactor in energy production, and also the insulin causes an increased retention of sodium, again pulling more fluid in and again increasing the blood pressure. So the effects of insulin would occur if you have a high carbohydrate diet. You end up with high glucose or blood sugar, which increases your insulin to higher levels and over time causes insulin resistance, and the mechanisms shown previously ultimately result in high blood pressure. Another effect of insulin is that insulin mediates blood lipids or blood fats. We have LDL, low density lipoprotein, which is combined of two types, the small particle and the large particle. The small particle is the sticky, more harmful portion of the ratio or the parts of LDL. HDL, which is high density lipoprotein, is helpful and heart protective by pulling cholesterol out of the bloodstream. You also have, with increased insulin, an increased amount of the small particle LDL, which is going to cause increased plaquing, especially with a pro-inflammatory diet. High insulin also causes, as noted earlier, a firing of the sympathetic nervous system, which constricts vessels and causes other things, including increasing LDL. Insulin is mitogenic, meaning that it stimulates cell division. When you have something that is mitogenic, there is an increased risk of cancer, because cancer is nothing more than an overgrowth and a continual growth of abnormal cell types, which are usually reduced or killed by a normal immune system. When you have increased endothelial cells lining your arteries, it helps to form more plaquing. So again, for increased insulin, these two factors create considerable damage to your body. Also, insulin converts macrophages to foam cells, or another type of immune cell, which accumulates in the fatty deposits in the cell walls in the arteries. So, as an overview for all of the horrible things that happen in your body when you develop insulin resistance and have higher insulin than you should have, you have increased low-density lipoprotein, small particle which is harmful to your arteries. You have increased blood sugar, you have constriction of arteries, you have retention of sodium, you have increased blood volume, you have further stimulation of the sympathetic nervous system, and you have downregulation of the immune system. Yes, it sounds like a nightmare to me. Furthermore, insulin resistance fills arterial lining with plaque, increases platelet adhesiveness or the stickiness of the blood, causes excretion of magnesium and excretion of calcium. You also have, because of the liver changes, a reduction in IGF, which causes a reduction of growth hormone and an increase in osteoporosis. You have a reduced liver function. You have a conversion of T4 to T3 in a less advantageous manner and in a less productive manner, and with less active form of thyroid hormone, you have slowing of metabolism. You have an increased insulin, which increases stress hormone levels, which has a devastating effect on liver function and shuts some of the liver and gut down as part of the fight or flight response. The DHEA is directly proportional to insulin resistance, which again causes a considerable reduction in many types of hormone production. Insulin controls or affects all hormones, and this is the reason why we see a lot of obese women with abnormal hair growth, developing facial hair and hair on other parts of their body. Let us look at carbs and cell damage. There are two mechanisms or methods that you have cell damage. One is from oxygenation, and since we must breathe to live, we are all causing oxygenation. The problem is that when we combine oxygen with something to break it down or burn it, then free radicals are released. There has been much interest and research done since 2009 with the free radicals and the shortening of the end caps or telomeres on our genetic material or chromosomes, which actually speed up aging of tissue. When something loses an electron, it needs to have those electrons replaced, and you should always have a significant amount of materials in your bloodstream that can give up an electron. Secondly, we have glycation. The problem is that when glucose combines with something, it becomes glycated. Protein combines with glucose to form AGEs, or accelerated glycosylated end products, which must be cleaned up or engulfed by the immune system. Glucose combines readily with protein and glycation occurs. It must be cleaned up and more proteins must constantly be made. Accelerated glycosylated end products, or AGEs, accumulate in connective and nerve tissue and some in blood vessels, causing plaque. This is the reason why diabetics that have increased glucose in their bloodstream produce many types of AGEs and end up with blindness, kidney failure, heart disease, and any tissue that is controlled with improper blood supply by arterial damage is involved. We have all heard of the diabetics and people watching their sugar, checking their A1C, which is nothing more than a particular or specific type of AGE. It gives us a good idea of how much glucose has been in the bloodstream by looking at the amount of glucose which is attached to the red blood cells, which live 3 to 4 months, and therefore we can calculate approximate levels of what the glucose has been. We also see that AGEs and macrophages speed up inflammatory response in collagen of arteries, creating cerebrovascular disease and heart disease. When you have increased glucose, you have increased insulin, you therefore have increased glycosylated or glycated proteins, creating more AGEs, which causes a pro-inflammatory state and destroys a many number of tissues in your body. High carbohydrate diet leads to insulin resistance sooner or later. It leads to all of the aforementioned consequences and is a major cause of cardiovascular disease, including high blood pressure, stroke, and various types of heart disease. We will talk briefly about carbohydrates and the problem with grains. When you eat grains, which in my opinion should not be consumed by humans since we cannot digest them properly, they are acidic and they cause calcium to leach out of the bones to reduce the acidity of the blood. There are many people that develop osteopenia or full-blown osteoporosis because they have had increased acetic levels for much too long. Grains contain phytic acid, which blocks absorption of calcium. And also, if you have a problem with gluten or one of the 11 breakdown products of gluten, which approximately 83% of the population does have, it is causing an immune reaction with possible cross-reaction to other tissues and is a proponent in the literature of the huge increase in autoimmune disease. Carbohydrate causes loading and downregulation of enzymes that allow triglycerides to be broken down and let out of the cell for energy production. Therefore, you tend to store more fat and burn less fat. Also, when you gain weight, the leptin levels increase, and the leptin levels are what gives us satiety or a full feeling. This is why very often very large people are hungry all of the time, not because their body needs anything, but because their leptin levels have been so high for so long, they develop a cellular resistance to leptin, and leptin no longer performs its function in the hypothalamus of the brain, and you constantly have a feeling of hunger. Please go through this seminar series a couple of times and understand all of the horrendous things that happen to your body if you eat too much carbohydrate, and especially simple carbohydrate or sugar. If you do not change your behavior by learning these things, then sugar and carbohydrate intake will cause lifestyle diseases, which are many and are the major reasons for illness in this country presently. Good luck with your knowledge and acquiring a new behavior.